While spring may be delayed, your Medicare changes aren't. Here's 4 changes to expect with your Medicare this year. First, let's talk about deductibles. Deductibles will apply to your prescription drug costs and also to your health plan. We've seen deductibles go from $0 on most drug plans. Those deductibles have increased by $50, sometimes $200, and even sometimes $590 on certain plans. This won't apply to every single aspect of your plan. So your doctor visits, your specialist visits, a lot of your lab and x-rays and imaging copays will still be available, but your deductible will apply to certain aspects of your plan. So it's important that you consult with your agent or broker to make sure that if you're going to get a procedure done, that you're not going to have an unexpected out-of-pocket cost. The next thing that we see is with the maximum out-of-pockets. Maximum out-of-pockets across the board have risen drastically in Medicare. $1,000, $2,000, $3,000, and maximum out-of-pockets as high as $11,000 on certain Medicare Advantage plans. A simple procedure, a trip to the hospital, is no longer $3,000, $4,000, $5,000. While that's a lot, we've seen those almost double. So a lot of plans last year didn't have premiums. It was very almost hard pressed to find a plan that had a premium. Now we're seeing a lot of these plans come out with premiums. While they're small, we expect those to continue to raise and for premiums to continue to raise as the years go on. The next thing that we see in changes is prescription drug costs and formularies. The first part of it is good news. While prescription drug costs have lowered and they've gone down, we've also seen the expansion of accepted diabetic medication in terms of your simple diabetic insulins and even some semaglutides that you're seeing on these formularies for certain plans that are now being accepted at $35, $37, $47, and maybe even upwards of about $70 on some of these plans. This is great news across the board for all people of all ages on Medicare. The issue is that when these plans got together and decided to accept some of these formularies or accept some of these drugs onto their formularies, we saw some of these formularies tighten. So yes, the donut hole has gone away. We've now got a $2,000 cap on all prescriptions. However, it's important to make sure that you know that all of your prescriptions are on the formulary, because the $2,000 cap does not apply to those prescriptions that are not on the formulary. The third thing that we saw was mental health was expanded. And so this is big news because we do know that right now in the United States, there is a mental health crisis. And so one of the things that the Center for Medicare and Medicaid Services decided that they needed to do was expand access to all seniors and all people who are on Medicare to get access to mental health. So you'll see more providers in your area, more private people in your area, and even some kind of not so traditional types of mental health services that will be covered under your Medicare plan. The fourth thing that we're seeing is networks are being restricted. Just as we saw in the ACA and the Affordable Care Act that some of these networks are restricted and you're starting to see certain plans partner with certain hospitals and block out other ones, we're starting to see that more and more and more as the Medicare Advantage road keeps on going. And so we've seen more hospitals, more doctors, more PT places and things like that are just simply deciding that they're not going to take one carrier, but they will take the other. And so it's very important that you stay up to date. News has broke out that certain plans were being dropped by certain hospitals across the United States, and this has drastically changed the way that people are using their healthcare. They're either having to change their plan during the open enrollment period, or they're having to find a new hospital to go to. So it's important that you stay up to date with everything Medicare based. And just remember, just as our seasons change, Medicare changes. Thanks for watching this video. Please make sure that if you liked our content that you either hit the subscribe button down below or leave a comment with any questions.